早晨，大家好啊！歡迎大家咧嚟到係更新會嚇，歡迎大家嚟到咧我哋更新會嘅肺癌支持小組。咁我哋嘅肺癌支持小組咧係每2個月一次，一般咧都係雙月嘅第1個星期一嘅嚇。咁今日有少少特別咧，今日係第2個星期一嚇，咁亦都係我哋首次咧係利用到咧係呢一個嘅YouTube 嘅機會咧，係嚟到咧係俾大家咧嚟到去直接咧係睇到我哋嘅直播嘅。好嘛哈，咁我而家用普通話稍微講少少哈，歡迎大家今天來到我們更生會的肺癌支持小組。我們的肺癌支持小組呢是每個雙月哈，就是26、80、12呢第1個禮拜一舉行的哈。這次有些特別哈，因為這個是第2週的星期一哈。那我們呢都是有這個10點半到大概12點或者12點半呢有一個肺癌的支持小組哈。今天呢我們的題目呢大家也都知道哈，我們是今天會簡介一下呢這個臨床試驗、免疫療法以及是它的這個副作用的處理嚇。咁今日我哋嘅題目咧，大家都應該喺之前睇到啦，係我哋係講一講咧係免疫療法啦，講講呢個臨床試驗啦，同埋佢嘅副作用嘅處理嚇。咁今日咧我哋亦都係好榮幸咧係能夠咧係請到係呢個 RPA Live House 呢邊嘅一個嘅肺癌嘅專科護士嚇，咁係叫做 Amy O'Donnell 咧，係嚟到咧同我哋咧係介紹呢個題目嘅嚇。今天呢，我們也是非常的榮幸呢，能夠請到Live House 呢一個 Lung Nurse Specialist 呢他呢會來到跟我們呢是講到這個題目的哈。那我在這裡呢，先跟大家說一下今天的程序哈。那今天我們首先呢會有大概1個小時左右的講座哈。那 Amy 呢是會以英文來講解的，我們現場呢大家可能看不見哈。但是我們現場呢是有個翻譯我們會把它的內容從英語翻譯成普通話哈。那因為我相信邊上面如果看的廣東話的觀眾呢，可能很不少呢是能夠聽得懂普通話的，但是如果倒轉過來呢又不行哈。希望大家呢能夠體諒哈，我們不能又翻普通話又翻廣東話哈。咁今日嘅內容呢 Amy 呢係會以英文呢係進行呢個嘅介紹嘅嚇。咁跟住呢我哋現場大家見唔到佢啦，但係咧 Amber 咧係喺我哋當中咧係幫我哋翻譯嚇。咁佢咧係會將英語咧係翻譯成普通話或者係國語嘅嚇。咁咧就因為我哋嘅時間嘅關係咧，我哋唔可以有翻譯廣東話有翻譯普通話。咁我相信咧係觀眾咧係大部分咧都能夠聽得懂。Amber 會慢慢講佢個普通話咧，大部分應該會聽得明嚇。再加埋有 PPT 咧，應該係會聽得到嘅，好嘛嚇？咁希望大家能夠體諒咧，係我哋唔能夠2種語言都翻譯嚇。咁喺呢度亦都介紹一下咧，因為我哋好難做到呢個現場嘅互動啦嚇。咁所以咧，我哋如果係喺YouTube 旁邊嘅你嚇對於成個講座係有一啲嘅問題嘅話咧，你可以打嚟俾我哋更新會啦。我哋嘅電話咧係92127789，你可以寫低佢啦嚇，係92127789嚇。或者咧，你可以咧係打嚟俾我哋嘅手機電話，我哋更新會有個手機電話嘅號碼咧就係0429178638嚇。我重複一次係0429178638嚇。咁咧你可以咧唔需要去到最尾先至打入嚟嘅，你一路聽嘅時間你有問題咧，你都可以打電話嚟問下。因為如果我哋集中晒喺最尾咧，我哋驚我哋聽唔切啲電話，咁我哋咧會代為咧係詢問我哋嘅講員嘅，好嘛嚇？咁這個今天的整個程序呢，是我們先由 Amy 呢來做一個講解哈，然後呢講完之後呢，我們會有一個提問的時間。如果你在YouTube 旁邊的你是聽見有一些提問的話，有一些提問你可以呢打電話來我們的這個電話92127789哈，92127789哈，或者是說呢是用我們的這個手機電話哈，04291786380429178638，你可以是發短信給我們，我們甚至鼓勵你是發短信，或者是呢是打電話到我們的手機嚇，我哋鼓勵你用信息啦嚇，即係電話嘅信息啦，係打俾我哋嚇。咁如果真係咩嘅話咧，你就可以打電話嚟俾我哋咧，亦都係可以嘅，好嘛嚇？咁咧就事不宜遲啦嚇，咁我咧就將呢個時間咧係交俾我哋嘅今日嘅嘉賓阿 Amy 嚇，那我們就把時間呢現在呢交給 Amy 來他講今天的主題哈，謝謝各位。
Hi there. just waiting for my interpreter to be ready and I'll start talking. You ready?
Yeah, ready.
All right, so thanks for having me, everyone. Before I introduce a little bit about myself and my background, I thought I would just say how important I think CanRevive is as a support for the Chinese community. I'm really relieved when I meet patients often that just speak Cantonese or Mandarin, and I can say there's this support community for you called CanRevive, and I kind of wish that we had it for other different communities as well and cultures.
非常感谢大家今天邀请我来。然后在我介绍我自己以及我的背景之前呢，我想要先跟大家讲一下，在我心目当中，更生会有多么的重要。更生会作为一个非常重要的支持的力量，它能够支持我们的中文社区的人群能够更好的了解癌症。那么在我平常看病人的时候，我也很欣慰的能够去给他们介绍有更生会这样的一个组织，能够让我那些只说粤语或者普通话的病人能够找到这个组织，然后找到帮助。那我希望别的语言群体当中也会有这样的组织。
A little bit about me. I've been working in the Lifehouse since we opened in about 2013. So my background is I worked a lot in the day therapy unit at Lifehouse, giving chemotherapy, giving immunotherapy. I've also worked in clinical trials for a little while, and I've worked in just varying other areas in Lifehouse. And also before my time in Lifehouse, I also worked in intensive care, I've worked in cardiology, so I've worked in a few different places.
那接下来我给大家介绍一下我本人。我本人是从2013年就开始在 Lifehouse 那里工作了。我之前呢有试过在那个白天的这个治疗部门，也就是我负责给大家进行化疗啊、免疫疗法啊等等来进行治疗的一些专科护士。然后另外就是呢，我也有参与一段时间的临床试验。此外，我还有在这个 Lifehouse 的其他一些部门工作，例如是急救部门以及心脏部门等等。所以我有在 Lifehouse 的各个部门都工作过。
So the first slide, I'm going to tell you a bit about what I'm going to talk about today. So clinical trials, I know that was a hot topic and Emily asked me to cover that, as well as the benefits, the disadvantages, what we actually have at Lifehouse at the moment. Just a couple of examples, we have really many. Going to talk about immunotherapy and the side effects and how it's a bit different to chemotherapy and how to manage these side effects, where to get help, which I think is probably the most important aspect, and then also we'll have time at the end for your questions. So please, if I don't cover anything or you have a burning question, please let us know and I'll try and answer it if I can.
那接下来给大家讲一下我今天讲话的主题。其实我主要会讲到6个方面，其中包括第一，这个临床药物试验。那这一点呢是现在的热点问题。Emily 呢也有向我提到过，要我给大家讲一下，相信大家也很感兴趣。第二点呢就是参加临床试验的利弊。第三点是现阶段我们有的临床试验。第4点就是免疫疗法的副作用，以及我们要如何去管理和减缓这些副作用。第5点就是如何获取相关的帮助，这一点是非常重要的。最后会留有提问时间，大家如果有什么迫切的问题想问，我会尽我所能解答。
Thank you. So when we talk about clinical trials, we talk about research in cancer, and there are different ways to research better treatments, and it's not just about drugs. It can be just about how do we improve outcomes, how do we make people feel better. So it's not just about giving a particular drug. That is a lot of what we do, but it's also about how do we improve people's experience, people's symptoms, people's outcomes.
那说到研究在癌症当中的作用呢，其实我们这个临床的试验研究啊，它不仅仅包括的是药物，还包括如何提高这个药物的疗效，以及如何提高人们在治疗过程当中的体验。所以这个临床试验呢，其实是包括整个治疗当中的方方面面的。
I guess an example of this would be, how is it different if we give treatment in the hospital versus treatment at home? That's not testing a new drug, but it's just testing a new ways. Does it make a difference where people are treated?
就例如是呢，我们会探究究竟病人是在医院进行治疗护理比较好，还是说在进行家居治疗的过程中，他们也能够获得不错的效果。那么，所以临床试验其实不仅仅研究的是药物，它有时候研究的也是这个护理的过程。
And a really important aspect that patients really need to understand, or anyone that need to understand if they're going to be or considering a clinical trial, is that it is really rigorously reviewed by science and ethics. So, it's not, they can't just do anything to anyone. It needs to be really ethical. I can't sort of stress that enough.
那另外我想讲的一点呢，就是希望大家都明白，其实参加这个临床试验啊，这个临床试验它是通过科学和道德委员会他们进行这个严格的审查以后批准了，我们才能够邀请患者参加的，所以我们并不会去逼迫任何一个患者来参加。
So we have different phases in clinical trials. This is just a general outline. There are actually even sub-phases within these.
那么大家在这个图上面呢，可以看到临床试验其实是有不同的阶段的。这个图上只是一个大概的流程，有时候不同的临床试验它所涉及的阶段也会不一样。
And these trials that I'm talking about particularly are mainly about drug trials.
那么图上面所显示的这个临床试验呢，主要是关于药物试验的。
So before I go to phase 1, I'll just quickly talk about preclinical. Basically, it's anything that they study in the lab. They've found maybe it might make a difference, or in an animal, for example.
那么我想说，在这个我开始讲临床试验第一阶段之前，我想讲一下，就是在临床试验开始之前，其实科学家或者医生是花了很大部分的时间在实验室里面去研究哪些可能的因素能够让疗效变得更好。
So phase 1 of clinical drug trials, they're basically shown they're conducted to see if the actual drug, the chemical compound, is safe to be used. So it's done in a really small group of people, and these people are monitored really, really closely to see if they have any side effects, and they're tested to see what's happening with the particular drug.
那么在临床试验的第一阶段当中呢，我们主要是测试这个药物或者是新型化合物的安全性。我们只会在一小部分、一个小范围的人群里面进行试验，然后这一小部分的人都会得到医生和护士的密切关注。他们会看看这个新型的化合物会不会对人们产生什么副作用，或者是它在治疗过程当中会产生什么其他的效果。
At this point, they're not testing if it's actually working against the disease. They just want to make sure that it's safe to be used. So often people, because of the amount of tests that they need to have, will actually stay in hospital because they might need, for example, to have a blood test every couple of hours for 24 hours.
那么在这一阶段的试验当中呢，主要是不会试验这个药物对病症的有效性的，主要还是先确保这个药物的安全性。那么因为在这一阶段，这些实验的对象他们都需要进行很多不同的测试，所以我们会要求他们留院观察，因为可能在24小时内他们会需要进行不止一样的这个试验。
So phase 1 trials are where the drug is first used in humans, and it has to be done at an accredited hospital or facility. So they have to have special accreditation, and Lifehouse is one of those places.
那么因为在第一阶段呢，这是我们第一次把这种新型药物应用在人体身上，所以必须要有资质的专科诊所实验中心才能够进行。那么 Crystal Brand Lifehouse 就是其中一家。
Yeah, and the example I've got, so the COVID-19, we all know that they're trying to build a vaccine, and when they start testing in phase 1, they'll do it only on like 10 to 20 people, no more than that, just to make sure it's safe.
那么例如就是现在这个新冠病毒的疫苗啊，我们在第一阶段的临床试验当中只是邀请了10到20个人，因为我们只会在这一小部分的人群里面进行安全性试验。
So then we move on to phase 2, clinical trials, and basically it's a bit more testing. Is it actually going to work as we would hope it would have? It's carried out with more people, so 100 or more.
那么在第二阶段的测试当中呢，主要是要试验化合物或者药物的药效。这一阶段的这个人群基数呢，大概是100人或者以上。
And at this point in trials, we're trying to test to get the dose right. Are we testing per kilogram? Are we making a flat dose so everyone gets the same? So they're testing out which dose is more efficient and better.
在这一阶段呢，我们主要会看看哪一个剂量是比较合理的。例如是说，我们应该根据这个病人的体重来制定剂量呢，还是说应该大家所用的剂量都一样？
And there are still lots and lots of tests done at this phase, but not as many as phase 1. And we're still really checking people for any side effects and seeing what reaction people have.
那在这一阶段呢，我们也会对那些参与试验的患者进行很多的测试，但是这个测试的数量就没有第一阶段那么多了。这一阶段呢，我们还是会通过不同的测试来看看病人对这个新型化合物的副作用以及一些不良的反应。
So then we go to phase 3 clinical trials. And so if a drug gets to a phase 3 clinical trials, it means that I guess it has shown some positive results leading up to that, and we're testing it on thousands, not hundreds of people.
那么当我们进入到第3阶段的试验呢，那就说明在前面的阶段当中，我们发现这个新的化合物所取得的疗效是还不错的。那么在这个阶段，我们就会涉及到更多的患者，例如是超过1000的患者来进行试验。
And we're testing in drug trials. We're testing how is it compared to the current treatment.
那么在这一阶段，我们会将这个新的化合物与现有的这个最标准的治疗方案进行对比。
And usually what the aim of phase 3 trials is can we replicate it? So usually they're on many sites in many different countries, seeing if we can get a similar result.
那么在第3阶段，我们有一个主要目的，就是看一下这个新型化合物在这个地方所取得的效果能不能复制到别的地方。例如是我们在不同的国家会有不同的试验地点，然后看一下每个国家所获得的试验成果是不是差不多的。
And there's still lots of tests at this point as well, so it's not like there's lots of tests.
在这一阶段呢，这个患者还是需要进行很多的测试的。
So just some common aspects of clinical trials. Often there are 2 different treatment options. For example, a new drug or a new combination of drugs.
那么现在我们讲一些临床试验的几大基本方面。首先就是临床试验当中会有2种或者更多的不同治疗选项，其中一种呢就是这个新药以及新的化合物。
We randomly allocate people to prevent bias. So you can't just choose, if there's 2 study arms, you can't choose which study to be upon. That sort of takes away the bias. So it's random allocation.
在这一阶段呢，我们会进行随机的分配，就是说患者没有办法去选择他们要接受哪一种治疗，这样的话就可以防止在研究当中出现偏见。
Accurate collection of data is really important. Obviously, you want to make sure that we're collecting what we say we're collecting, that's really important. And there's a lot of ethical considerations when you talk about collecting data, but usually we have an outside company that monitors to make sure that everything is being done the way it should be done.
那在这一阶段呢，准确收集数据是很重要的，这也是出于我们的道德考量。我们要确保我们收集的信息是正确的，以及在这个时候，我们会邀请一个第3方的公司过来专门的监管我们在采集数据的过程中是否是合理的，有没有按照我们规定的流程走。
And of course, it's always up to you if you want to participate in a clinical trial. It's all about informed consent. Whether you want to or not, there's no repercussions for whichever decision you make. It's just about making an informed decision, and us as the supporting team, our aim is to help you with that.
那么在这一阶段，你是否想要参与临床试验呢？主要都是取决于患者自己。我们在参与临床试验之前呢，都是先要获得病人的同意的。我们是不会逼迫这个患者来一定强制他们进行这个试验，而且在试验之前，我们会让病者充分的了解到这个试验是什么。
And yeah, you can only be in a clinical trial if you give your consent and you're aware of what the study requires of you.
我们是需要得到你的同意，也就是说你在同意之前，你要知道研究具体会涉及哪些内容，研究会需要您做什么，我们才会对您进行临床试验。
And at any point in trial, if you're on a trial, that also means you can take away your consent and you can leave the trial.
那么在试验过程当中，如果你觉得你想要停止了，你不想继续了，你也可以告诉我们，我们会给您停止试验的。
I think it's just important to remember and to emphasize that people can't do anything to you without your permission at any point in time. So there should always be informed consent for anything that you give permission to.
在这个试验的过程当中，医生或者护士所对你做的任何事情，都是会先获得你的同意才做的。我们不会在没有获得你的同意的情况下，就私自对你做一些治疗或者处理。
And I guess what I hope for as a nurse and as someone supporting people with lung cancer is to empower people to make decisions that they want to make. It's not about what I think is right for you, it's about helping you get to a decision that's best for you.
那么作为一个专科护士呢，其实我主要的工作不是说告诉你们哪一种是最好的，而是我在告诉你们我认为哪些好了以后，你们可以自己去考虑，然后你们可以根据自己的选择，得到了你们的同意，我们才会对你进行下一步的治疗。
So this next slide is a bit about benefits and non-benefits, disadvantages of being in a clinical trial.
在这一页呢，我会讲到参与临床试验的利弊。
So some of the advantages research shows, so being in a trial will increase support for people.
研究表明啊，参加这个试验，你就能够获得更多的支持服务。
For example, all the tests are paid for.
例如是所有的检测都是公费报销的。
And you do get a special clinical trials nurse usually allocated.
然后通常你会分配到一个专属于你的专科护士。
It gives you access to potential new treatments that you wouldn't otherwise have access to.
然后你也可以获得其他人可能没有办法获得的一些比较最新的疗法。
So it increases the monitoring, which some people see as an advantage. So you get more blood tests, more scans.
在这一阶段，你所获得的这个监控的强度也会更大，也就是说，你能够获得更多的血检或者是扫描，能够让医生了解你的情况。
And sort of as I said, you may usually receive additional costs covered, such as parking. Usually you're in a clinical trial, it should be of no cost to you.
同时，你也可能会获得停车等等的额外费用的补助。
And there is the altruistic aspect. So sometimes, even though being on a clinical trial, it may not help you, but you have the thought that it would help someone else after you. So some people take comfort in that.
那另外就是参与临床试验呢，其实也是在为大众谋福利。尽管有时候这个试验的结果对你来说帮助不一定大，但是其实你也在为后面的人来做出贡献。那么有的人呢，他就会因此有这个成就感。
So on the flip side of that, being in a clinical trial, it can require you to come to hospital more, which is really, if you're not feeling well, some people don't want to do that.
那么至于弊端方面呢，可能就是需要你更加频繁去医院。那么例如有的人他身体不适，可能他就不那么想去医院了。
It can require more additional blood tests or scans, so potentially more needles.
那可能也会需要你进行额外的血液检查，或者是其他的一些扫描，可能你就需要打更多的针。
And as I said before, with random allocation, you can't choose which treatment you get. So, you may not get the one that you're hoping to get.
那么像我之前说到的临床试验的这个试验对象，他们所接受的疗法都是随机分配的，所以你可能无法选择你用什么方案，有时候你不一定能够抽到你想要做的那个方案。
You might, because of the trial that you're on, you might get some more symptoms and side effects, so that's something to consider as well if you're already not.
然后因为在试验嘛，你也可能会遇到其他一些症状或者副作用。
While there should be no out-of-pocket cost for you, you're not actually going to be paid to participate in the trial.
然后因为在试验当中您不需要付费，所以你也不会因为参加研究而获得任何的报酬。
And you may not know which treatment you get. You may never know.
您可能永远都不知道自己在接受哪一种疗法。
And yeah, because it's a clinical trial, you may not benefit from the treatment. I think, we all hope that people will, but you might not.
然后因为这是一个试验，所以治疗方案可能对您是没有效的，但是当然医生都希望这个方案对您有效。
All right. So if you're going to participate in a clinical trial, I guess this is a bit of a slide about what questions, what do I need to know? So you're only going to be offered a trial if your doctor thinks it's appropriate and it will benefit you generally.
那么关于如何参与这个临床试验呢，我会给大家讲一下，在临床试验之前你们要知道什么，要了解什么。另外就是你的这个主治医生呢，仅仅是在他认为这个临床试验可能会给你带来好处，可能会符合你这个整体的身体状况，他才会给你推荐临床试验的。
And so your treating doctor will know of all the potential clinical trials that are out there, and know also what's available.
那你的主治医生呢，他最了解你现在所患的这个癌症有哪一些临床试验，以及哪一些是你可以用的。
If your doctor thinks you are potentially possible for a clinical trial, you can participate. They will give you a booklet which is about that thick, about all the ins and outs of the trial. So there's a lot of information that you will take away.
那么如果你的医生认为你可以参加这个临床试验呢，他到时候会给你一份小册子，在小册子里面呢是有这个有关于临床试验以及其要求注意事项的详细的书面信息。
So it is a lot of information, and it's just important to write down questions and make sure that you're comfortable with what you know about the clinical trial.
那么在这个小册子里面的信息量是很大的，所以呢，如果你有任何的问题，你可以写下来，然后在见医生的时候可以当面去问。
And of course, if you decide that you want to go ahead with the trial, of course you will be asked to sign a consent form.
那么如果最后你同意参加临床试验呢，医生就会让你签署书面的同意书。
But as I said before, this consent can be taken away at any point if you decide that you don't want to participate in the trial anymore.
那么像我刚刚讲到的，假如试验过程中你不同意了，你也可以直接撤销这个同意书。
Excellent. So who can I talk to about the trial? So as I said, it's really important that you write down questions and that you have a good grasp and understanding of what's involved in the trial.
那么在试验过程当中，你应该向谁提问，向谁咨询呢？我刚刚提到的就是您有任何的问题可以先写下来，然后你可以见医生的时候去问他们，同时你也可以多一点了解你这个试验。
Really important that you talk to your doctor. If you have any questions or concerns, the doctor is the expert in the trial and will likely have other patients on it, so will know a lot about the trial.
那么如果你有任何的疑问或者担心，记得一定要跟您的医生沟通，因为您的医生是这方面的专家，他所提供的意见会比你身边的一些病友来得更加专业。
So as well as discussing it with the doctor, it's really good to discuss it with the family, as well as someone like yourself, or someone that you feel supported by.
那么除了跟医生讨论以外，你也可以和家庭成员讨论，或者是像我本人的这样的专科护士来讨论，只要您认为这些人是可靠的。
And this could be your family doctor, like your GP.
你也可以跟你的家庭医生讨论。
And as I've said a few times, the decision to participate is always voluntary, And if you choose not to, you will still get the best of care that we have to offer otherwise.
那么，正如我刚刚讲到的，是否加入这个临床试验，完全是出于您的自愿。假如你不同意参加，你也可以继续得到最优可能的治疗。
And yeah, of course, it's also okay to withdraw at any point if you want to.
如果你觉得无法继续临床试验的话，你也可以申请终止。
And there's no disadvantage for that. Yeah.
申请终止也不会给你带来任何的不好。
So I thought I'd talk about. I just have a couple of examples of trials that we have running now at Lifehouse. Just briefly, I'm going to go over them quickly. So they all have funny trial names. This one's called LOXO 292.
那么接下来我会讲一下现在在 Lifehouse 我们有的一些临床试验，我只是会简单提一提。那么每一个试验它都有一些比较特别的名字，例如第一个叫做 LOXO 292。
So this trial is currently in phase 3. It's a phase 3 clinical drug trial, and it's offered for people who have a particularly rare form of lung cancer. It's a particular rare mutation, and it's offered as first-line treatment. This means it's the very first treatment that they get.
那么这一个试验现在是处于第3阶段的临床试验，它主要是为一些比较罕见的肺癌病例来提供最前线的治疗方案。
Okay, and the next trial I'll talk about, as I said, they're funny names. So this one's CA20777T.
那么第二个试验也有很可爱的名字，叫做 CA20777T。
So this trial compares treatment with immunotherapy prior to surgery versus surgery alone in early stages of lung cancer.
这个试验呢，主要是针对一些早期的肺癌患者，他们会将手术前进行免疫疗法以及这个单独进行手术的治疗来进行对比。
So this is not applicable for people with stage 4 or metastatic lung cancer.
所以，如果那些患有第4阶段或者是晚期肺癌的人群的话，是不适用的。
And yeah, it's quite complicated. It's not as straightforward as you might think, because there are possible surgical implications with immunotherapy that we're still learning about.
这是一个比较复杂的试验。那么现在我们对于这个免疫疗法所带来的一些症状或者是副作用，我们也还在研究当中。
Okay. So I'll talk a little bit about immunotherapy. So what is immunotherapy? So we know immunotherapy works on your immune system. So it works on getting your immune system to see the cancer and kill it that way.
那么现在给大家介绍一下什么是免疫疗法。那么顾名思义，免疫疗法呢，就是要加强人体的这个免疫系统，然后让我们的免疫系统能够识别到癌细胞，然后对它们进行狙击。
And cancer is very tricky in evading our immune system, and we've known that. So we have these immune systems to basically, how do I explain?
那么我们身体里面的癌细胞呢，其实是很狡猾的，它们很懂得如何去躲避免疫系统的狙击。
So if we think of cancer as like someone wearing a cloak and a disguise, our immune system is trying to take off that cloak, realize what the cancer is, and kill it that way.
那么举个例子说，就是我们的癌细胞呢，有时候会穿上一层这个掩护的外套，也就是所谓的隐形衣，让我们的免疫系统没有办法识别。那么免疫疗法呢，就是去激活我们的免疫系统，然后让这个免疫系统去脱掉这一层保护色，然后去识别癌细胞。
And I mean, when do we use it? We use it whenever a clinical trial has shown that it works and is effective on the cancer.
那么什么时候采用免疫疗法呢？我们只有在通过临床试验去发现免疫疗法的确对于该病例是有效果的、有好的疗效的，我们才会用的。
And the first cancer that we know it was most effective in is melanoma. That's the really bad skin cancer.
那么我们所发现的第一种就是由免疫疗法治疗会带来很好疗效的癌症，就是这个黑色素瘤，也就是一种比较严重的皮肤癌。
And because it worked so well in melanoma, they're trying lots of different types of cancers to see if they can get a similar result.
然后因为这个免疫疗法在黑色素瘤当中的这个疗效是非常的好的，所以现在医生们也有在研究，把这个免疫疗法放到其他的癌症治疗上面。
And thankfully in lung cancer, we have found it to work in certain situations.
然后在肺癌方面呢，我们也发现免疫疗法针对某些特定类型的肺癌是有很好的疗效的。
However, I must stress too that it doesn't work for everybody.
那我也得重申一点的就是，免疫疗法并不是对所有人都适用的。
I think, we get a lot of people that come into the hospital and they've heard about immunotherapy on the news and they're like, can I have that? Is it for me? But it's not for everyone.
就例如是很多的人，他们在来医院找医生的时候，他们可能会因为网上看到很多信息说免疫疗法很不错，然后就要求医生给他们用免疫疗法。但是免疫疗法其实并不适用于每个人。
The two main types of immunotherapy that we use work on two different systems. So I'm not going to get too technical, but it basically works like a lock and key mechanism where we're trying to uncloak the cancer so that the immune system can recognize it. One of the drugs called ipilimumab works mainly on the CTLA4 lock and key mechanism, and the pembrolizumab or nivolumab often works on the PD-L1 lock and key mechanism.
那么免疫疗法呢，其实有两种不同的类型。那么首先比较常见的一种呢，就是这个锁食的机制，也就是大家可以从图上面看到，就是它 PD-L1 所对应的这一个受体呢是叫做 PD-1 的，然后大家可以看到上面紫色那里那个 CTLA4 它所对应的呢就是 B7， 它们是对应的钥匙还有锁头的关系。
So for example, if you can see on that pink cloud at the bottom where it says PD-L1, that comes from the cancer cell, and what it's trying to do is it's trying to stop the immune system from doing what it should do.
那么例如大家看到下面粉色的那个就是癌细胞，那么最下面癌细胞所产生的 PD-L1 的这个因子就会给它们披上一层保护衣，然后这个保护衣就是让人体的免疫系统没有办法识别出来它是癌细胞。
So we're trying to stop what the tumor cell's doing and block that.
那么我们免疫疗法呢，就是希望能够去屏蔽这个癌细胞生产 PD-L1 这个因子的能力，所以这样就能够让它停止去产生这个癌细胞的保护衣。
Okay. So next, looking at side effects of immunotherapy. So many and varied. It's very different to chemotherapy. So if you think of the immune system, basically we're saying to the immune system, please flourish, go and do your stuff on cancer, but often it can also have its side effects on any organ.
那么接下来我们谈一下免疫疗法的副作用。那么免疫疗法的副作用是很多而且很容易变化的，它的副作用是不同于化疗的，同时它也有可能会影响到你的本身的免疫系统里面的一些因素和条件，例如是它可能会影响到你身体旁边的一些器官。
For example, your skin is an organ and you can develop a rash, so that's something that we need to monitor for.
那么例如皮肤也是人体的器官，在这个过程当中，皮肤所产生的副作用有可能就是你会起这个皮疹，所以我们需要进行密切的关注。
Obviously, your lungs are also an organ, so that's something you can get inflammation of your lungs, so that's something that we really need to watch out for.
那么另外呢，肺也是我们人体的器官，所以有时候这个副作用会包括这个肺部的发炎，这个时候我们也会密切的去留意。
And yeah, on that picture, you can see all the different organs and where a potential side effect could be.
那么在右边的这个图上，大家可以看到在身体不同器官可能会产生的一些副作用。
But the most common side effect we see usually is a rash, colitis, inflammation of the bowel, pneumonitis, inflammation of your lungs, and often your thyroid can be affected as well.
那么比较常见的一些副作用可能是包括皮疹啊、结肠炎啊、大肠的发炎啦，或者是肺炎等等。
So what can you do to manage these side effects? I guess when I talk to patients, I don't expect people to be an expert in immunotherapy and its potential side effects. So it's about knowing who you should contact and having someone to contact if you need help.
那么接下来会讲到如何应对副作用。那么在日常与病人的交流当中呢，我其实也知道病人们他们可能不是免疫疗法方面的专家，所以对于他们来说，最重要的就是要知道有需要帮助的时候应该跟谁联系。
You know, you can be informed about what to be alert for. I think it's good to maybe know the most common ones, but because there are so many, it can be quite difficult. I think it's about getting in touch when something happens and you're not sure about.
那么另外呢，就是你要知道有哪些要注意以及要警惕的内容。那么有一些东西呢，可能是用常识就可以解决的，但是可能有一些比较细微的方面，您不太了解的话，您还是要及时的与专业人员进行联系和咨询。
And of course, asking lots of side effects about what you can do to reduce them. So, you know, if you have a rash, you sort of know that that's expected. It's important still to get in contact to see what we can do to manage that rash, because it may not be severe, but it's something that we can do to make your life a bit better.
就例如是在副作用方面，你也可以去了解哪一些措施是可以减轻这个副作用的。例如在这个开始之前，你知道它会有这个皮疹，尽管有时候皮疹不是很严重，但是您也可以提前去问这个专科的护士，问一下有什么方式可以缓解这个症状。
If the side effects do become, we call level 3 or 4, which means they're quite bad, there are some drugs that we give you that dampen the immune response. Usually we start with a steroid.
那么如果有的人他的症状是反应非常强烈的，然后他的副作用很严重，那么医生也会给他们一些药物，这些药物可以去减缓这个免疫的反应。那么有时候我们比较常用的是类固醇。
And it's really important that when something new comes up, you let us know straight away, because we can usually get on top of that pretty quickly.
那么如果有任何新的症状，一定要尽快的与专业的医生以及护士联系。那么医生可以根据他们的经验来对你解答，不要拖延。
Sometimes people are afraid to tell us about the side effects because they think we might take them off the drug. So if you delay in telling us, your symptoms can get worse and it can be harder to manage. So it's really important you tell us, or whoever your health provider is, as soon as possible.
那么有时候有些病人会很担心把自己的副作用告诉医生，因为他们怕医生会因此给他们停药。但是其实不然，我们千万不要有任何的拖延症，因为拖延的越久，这个情况就越难处理，所以一定要及时的与医生沟通。
And of course, it's always important to get your information from your treating team, your hospital, from the right place. We tell patients try not to Google too much because you can find anything on the internet.
然后呢，尽量就是要从正确的来源获取信息，例如是问你的主治医生，问你的专科护士，而不要在网上乱搜太多。
So I've listed a couple of places you can go to the internet to get information from. So a really good one that a lot of patients have spoken about is one called I Heard from the Cancer Council. So you can basically type in a question that you might have and they will answer it. They'll go away, research and answer it for you.
那么在这一页上呢，医生给大家列出了好几个信息来源的参考。那么首先第一个呢，就是比较常用的，由这个癌症协会所推出的 I Heard 的这个服务。在这个网站上面呢，你可以把自己的问题用打字的方式打过去，然后那边的人呢，他们会先进行搜索还有研究，然后再给你回复的。
You know, for example, vitamin C is one of the myths or one of the things people ask about, so that would be a good place to go for that.
那么例如是很多人可能对维他命 C 是有疑问的，他们就可以通过这个网站来进行搜索。
Or maybe a friend has told you the latest miracle in cancer treatment and you want to check it out. That's probably a good place to go as well.
那么例如是您身边有朋友向您推荐了一个新的癌症疗法，或者是其他新的这个补充品，你也可以在这个网站上面搜一下。
And if you are a Lifehouse patient, you do have a 24/7 contact. We have an after-hours nurse unit manager that takes calls if you have any issues. So if it's midnight, if it's the weekend, if it's a public holiday, if you're a Lifehouse patient, you've always got someone to contact.
那么在我们的 Lifehouse， 我们也会提供这个全天候24小时的电话专线，无论是在深夜还是周末还是公众假期，你都可以打过去问。
I mean, the EviQ website is also a really good website that has examples of how to manage certain side effects. So, for example, dry skin or fatigue.
那么在这个 EviQ 的这个网站呢，上面也可以搜到一些比较常见的副作用应该如何解决。例如说你的皮肤很干呐，或者是你感觉疲惫的时候应该怎么解决。
And they also do have some things translated. Not everything, but they do have quite a bit of resources that are translated.
上面也有一些资料是已经翻译成中文的。
Okay, that's the end of my talk. And so if anyone has any questions, please let me know. It wasn't very interactive, so I couldn't sort of answer questions as I was going, but if you have any, please let me know.
那接下来是提问时间。I have got some questions raised by the. So the first one is, where could we know that what clinical trials are available in Australia?
That's a good question. I'm pretty sure. So you can go to the Lifehouse website to see what's available at Lifehouse. But in terms of Australia, I think there is a website, and I don't know it off the top of my head. But I think there is somewhere you can go. Maybe it's something I can get back to you and you can provide to you. But I'm pretty sure you can type in and it comes up with, you know, where a particular trial is available. Because I've looked up some myself in the past, just where is a trial available, and it was available in Perth only. So I can get that information to you.
那么刚刚我们收到一个听众的提问，就是我们在什么地方能够知道有什么样的临床试验在澳洲能够进行呢？那么医生给的这个回复就是，大家可以在我们 Lifehouse 的网站上面进行搜索。那么另外就是针对全澳范围呢，其实也有一个网站可以搜的，但是医生现在还没有这个具体网站的名字，等他回去查了，他会再告诉大家的。那个网站上面可以告诉大家具体哪一个地方有在进行哪一个具体的试验。So the second question is that, can I request my doctor to let me get into the clinical trial or to let me participate in the immunotherapy?
So your doctor will always, he'll know all the current trials that are running in your circumstance. So for some people, immunotherapy does not work. And trials have shown that immunotherapy is really promising. So they've really tried everywhere, like they've tried it in lots of places. So if it's possible, your doctor would definitely have recommended it or told you about it. But yeah, I would suggest seeing your medical oncologist and talking about that. What was the first part of that question again?
So if the patient wants to get into clinical trial, could he ask the doctor to let him get into that trial?
I mean, you can ask the doctor for sure, but a good medical oncologist should have flagged it with you if you're appropriate already. So you can always ask, but trials also can be quite difficult to get in. Like you have to have a specific criteria. So, you know, for example, you have to, for some trials, you have to have measurable disease and it has to measure past 10 millimeters, for example. I'm just sort of making up a figure. But so if you have cancer that's smaller than that, you may not be able to get into that trial. So it can be really specific. Some trials don't allow you to have anything like diabetes or any other specific conditions that might affect the trial. So there's quite a select criteria. So some people will definitely try to get on a trial, but they fail because they've got certain things going on that mean that they can't access that trial.
那么第二个听众的问题就是，我能够要求医生来参加做这个临床试验，或者是用免疫疗法吗？医生给出的回复就是你的专科医生在给你提供治疗方案之前，他会先帮您筛选，如果你的这个癌症类型是属于这个临床试验所对应的这个标准的话，他们就会先给你建议。那么当然了，你也可以问一下医生，在你这个病情有没有任何现在正在进行的临床试验可以让你参与。那么另外就是，正如医生刚说到的，免疫疗法可能不一定对每一个人都有用，那么所以也不是每一个人都适合去用免疫疗法的。那么有的人他可能很想去用免疫疗法，或者有的人很想去参与临床试验，但是因为他们有时候身体的这个癌症的状况还有大小不是让他们没有办法去参加这种试验或者疗法的话，那么医生也不会建议。And the third question is that if the patient is not living near to the live house, can he request to accept immunotherapy treatment in live house, or can he request to participate in the clinical trial in live house?
So if you don't live near live house, you just have, and your cancer is appropriate to have immunotherapy, which your doctor would decide, you need to be seeing a doctor at Lifehouse to get treatment at Lifehouse. Immunotherapy is given in many centres across Australia. So most hospitals they have a cancer unit, will give immunotherapy. And there was a bit about clinical trial. What was the second part?
Yeah. So the question's about if the patient is not living near Lifehouse, could he accept immunotherapy or the clinical trial in Lifehouse?
Yeah. I mean, we have rural patients from Dubbo, from all over New South Wales that come to Lifehouse for a specific trial or travel. So if you're eligible for a trial and you've got a doctor here, then you can. Yeah.
那么第三个问题就是，如果我不是在 Lifehouse 附近住，我能不能要求来 Lifehouse 做这个免疫疗法或者临床试验的治疗？医生说呢是可以的，就是在 Lifehouse 也有来自全新州的各个地方的这个患者，他们有需要的话都可以来 Lifehouse 来咨询还有治疗。但是在开始治疗之前，他们一定要先见一下 Lifehouse 的专家以及肿瘤科的专家，然后由专家给他们开出具体的治疗方案。And the next question is about the course. It means how many times that the patient will need to accept when he's receiving immunotherapy, and how can he know whether it's effective for him?
So how long you receive immunotherapy depends on what's in lung cancer. It depends on what stage of lung cancer you're at. There's certain circumstances in, for example, stage 3 lung cancers where you'll get immunotherapy for 12 months. If the lung cancer is stage 4, usually we give it until it stops working. So if it works, usually up to 2 years or until it stops working. And we know it's working because we see on a scan that the cancer's shrinking or staying the same, and also that you're feeling well or hopefully better. Because if we can get a cancer to shrink, hopefully those symptoms will alleviate. If you've got pain because the cancer's pressing on something, hopefully that pain will be less because the cancer's smaller. Does that make sense?
那么下一个问题就是有听众问到，一般免疫疗法通常要用多少次，以及他要怎么知道有没有效？那么医生的回复呢，就是这取决于你的这个肺癌的阶段。例如是您是第3阶段的肺癌，那么可能免疫疗法呢就需要做为期12个月的疗程。那么如果你是4期的这个肺癌，那么医生可能就会一直用药到这个免疫疗法已经无效。那么有些人可能会需要用药2年。那么医生可以通过每一次 次的这个扫描来看一下这个免疫疗法对你身体的癌细胞有没有作用，例如是你身体的癌细胞有没有缩小，你或者是还是维持一样的大小，例如是你本人有没有觉得舒服一点，你的痛楚有没有减少一点。这个问题是重复的，那我就不问了。And the next question is about what will be the testing period of the clinical trial? So how many months or how many weeks?
So there's thousands of trials, and it's very dependent on the clinical trial itself. So some of them, and it depends what phase as well. So they all have their own really strict criteria and schedule. So sometimes you might need a CT scan every 4 weeks, or sometimes it just depends on the trial itself. Usually up front you have a lot of tests, at least initially. For example, if it's a stage 3 trial, and then you just have your regular scans. It could be every month, could be every 6 weeks. It just really depends on the trial.
那么下一个问题就是临床试验的这个试验期有多长？其实这个很难说的，因为现在有很多的这个临床试验，然后每一个临床试验它所处的不同阶段，它所做的不同类型，都会直接影响到它这个试验期的长短。而每一个临床试验都是有它的严格的日程表，医生都会照着这个日程表来做的。例如，有的人参与临床试验，他可能就每4周要做一次 CT 的扫描；有的人可能每个月要做一次检查，或者6个星期做一次检查，这主要都是取决于每一个临床试验的不同而言的。And the next question is that when the patient actually participates in the clinical trial, must he go through all the phases of that clinical trial?
No. So you're not in phase 1, 2, and 3. Like, it doesn't work like that. Usually you're phase,
Only one phase.
Yeah.
那么下一个问题就是有人问到，是不是如果参与临床试验就要参与临床试验的所有阶段？其实不是的，每一个病人他只需要参与临床试验的其中一个阶段就可以了。
So to add to that, usually a phase 1 trial will take phase 1, 2, or 3. It takes years per phase.
那通常可能从第1阶段到第3阶段，它可能每一个阶段都是大概要1年的时间。那么另外我想更正一下，就是 Amy 她是肺癌的专科护士，不是医生，我刚刚可能有点口误。And the next question is that the patient is now, for example, the patient is now receiving the targeted therapy.
Yep.
Could he choose to switch his treatment to immunotherapy?
I mean, obviously it's always about what the doctor would prescribe, and I mean, if it was possible and if it was of benefit to you, then the doctor would tell you that. From my knowledge, we don't give a targeted treatment and immunotherapy. It just doesn't work, but you need to speak to your doctor about that. But, medical oncologists are amazingly, informed. It's their job. They know the ins and outs of that particular cancer and what treatments are there. So your doctor is the best person to talk to about what treatments you want to be on.
那么下面一个问题就是治疗方案是否能够转变，例如是由标靶治疗变为免疫治疗。那么这个Amy 护士呢给大家提供的意见就是，您还是要问一下您的主治医生，因为如果就您的情况换成免疫治疗对您是有帮助的，对您是有利的话，您的医生会主动告诉你。那么在这一方面，如果您有任何的顾虑和担忧，您也可以直接问您的主治医生，因为他们会告诉你所有的选项。Yeah, that's all.
Oops.
Well, thanks very much, Amy, for
No problem. Thanks for having me.
with all our patients. It's informative.
I hope so.
Hopefully we can do a bit more of this in the future.
Cool. Thank you for having me. Wow, that's amazing. I'll hang that up on my... Oh, thank you. Thanks, Eric.
Thanks again.
Thank you. I hope it was useful. I hope you found it good.
Thank you.
Okay. Cool. Is it finished? Oh, sorry.
我們非常感謝 Amy 今天嚟到我們當中我哋好多謝 Amy 咧，同我哋今日係有同我哋一個簡介啦咁頭先都唔記得介紹我自己係更生會嘅職員啦叫 Emily 我是更生會的職員，我叫 Emily 你們會收到我的信息那今天呢，雖然我們只是一個講座的部分，可能缺乏了一個互動的部分但是呢，我們希望你呢，如果是有興趣的話呢，我們明天的同一個時間10點半到11點半，我們是會通過 Google Meet，然後呢會有一個就是支持小組的我們明天同一個時間10點半到11點半左右呢，我們會有通過 Google Meet 呢來做一個的支持小組來針對今天的話題有一些後續，或者你有什麼問題的話呢，你也可以明天我們再討論一下然後呢我們再互相支持一下好嗎我現在還沒有給大家發那些明細，因為我不想大家一下子收了太多信息會很混亂。今天下午呢我會給你們發信息或者是打電話那希望呢你們有時間的話呢，明天我們也一起參加這個支持小組我們今天呢今日呢我哋主要呢都係聽個講座啦冇一個交流嘅部分。咁我哋聽日呢係有一個肺癌支持小組嘅10點半至到11點半或者12點咁呢希望呢大家如果有時間嘅話呢可以參與。咁我哋可以就今日嘅題目呢係嚟到係相互係溝通啦同埋呢係相互係支持嘅至於個方式方法呢，我係未發俾大家嘅，因為唔想大家呢好混亂咁係今日下晝嘅時間呢，我會打電話俾你哋啦，又或者係發呢個信息俾你哋嘅，好冇咁呢就另外呢，就係今日你哋個 link 呢，如果你今日呢係睇唔到呢個嘅講座，即係譬如你有啲第啲嘅事情忙碌，你今日睇唔到呢，你想晏啲睇嘅話呢，應該都係可以睇到嘅。今天如果你因為事忙沒有辦法直接看到這個 video 的話呢，你也可以呢晚一點再用這個 link 的話呢，也應該能夠看得見的，好嗎咁喺呢度呢，我都想宣傳一下呢，我哋喺9月份呢，好快呢就會係做一個係 Living with Cancer 啦，叫做係面對癌症嘅課程主要呢係針對係2年以內嘅新病人。但係如果你話你對呢啲題目有興趣，而你都想參與嘅話呢，咁亦都係歡迎你係登記嘅。但係呢個呢都係必須要登記。我哋亦都係通過今日呢種形式呢，係將一個嘅連接呢俾你呢，係通過 YouTube 呢嚟到去睇嘅那我們在9月份呢會有這個面對癌症課程然後呢一連4次從9月2號一直到9月23號，每一個禮拜3的早上的10點半到大概12點鐘左右然後也是通過相同的形式呢，就是我們會給你一個YouTube 的 link， 然後你可以呢就是摁這個 link， 或者我們現場也有一些位置，如果你是要來參加的話呢，你無論是 link 也好，或者你現場來也好，你都必須得提前報名，可以打我們更生會的電話92127789或者呢我們也有一個 online 版本的，你可以直接就是我們可以發給你一個 link 呢，你就直接來登記都是可以的咁我哋到其時呢現場都有啲位嘅如果你有興趣嚟我哋現場喺Chinatown 呢邊嗰個總部嘅話呢，你可以嚟啦咁但係呢無論你係現場又好或者 YouTube 又好呢，你都係要提前登記嘅。請你打我哋更生會嘅電話92127789呢係要登記啦咁我哋可以就咁打電話登記，又或者呢我哋同事呢可以發一個連結俾你呢能夠登記嘅。咁喺呢度宣傳一下呢，9月2號呢我哋會有癌症治療新轉機Dr. Carol 張呢，佢係一個血科嘅醫生嚟嘅，佢會同我哋講一講呢個癌症治療新轉機。9月9號呢係講放化啦，同埋係標靶治療嘅副作用啦，係一位專科護士呢，佢會嚟到講嘅 Priscilla Lam。跟住呢就係9月16號有一個叫做提升抗癌食力嘅營養篇，我哋有位營養師最後9月23號呢就係由朱小書中副教授呢，佢會講中醫藥點樣可以輔助癌症康復嘅那我們在9月份有面對癌症課程4節課，9月2號治療癌症新轉機是由 Carol 張來跟我們講的。然後9月9號是放化療以及是標靶治療的副作用有這 Priscilla Lam 來一位專科護士來跟我們講9月16號是提升抗癌力的這個營養篇我們有一位營養師 Victoria 來跟我們講。最後9月23號呢是 中醫藥如何輔助癌症康復，是由朱小書副教授呢來跟我們講的。所以呢，就是很豐富的4節課哈，希望大家呢都能夠是登記哈，92127789哈。那今天的時間呢就先到這裡哈，非常感謝大家的參與哈，好多謝今日大家嘅參與哈。我哋今日嘅時間呢先到呢度哈，聽日哈，如果你係肺癌病人嘅話呢，聽日都歡迎你係參加我哋嘅肺癌支持小組互動嘅部分哈。多謝各位，謝謝。